Now the next thing is we got a case of facial nerve injury. Crocodile tear syndrome. You got a case of what? Crocodile tear syndrome. Crocodile tear syndrome. What is crocodile tear? What is crocodile tear syndrome? When the crocodile is having food, he is crying. He or she, both are crying. It is crying. Now it is okay. So crocodile tear syndrome, when the crocodiles are having food, they will cry? Yes. Why they will cry? There is some other reason for that, but this is human now. Human is also crying. Why the human is crying? What is the question? See, this question is crocodile tear syndrome. This man is crying whenever he is having food. Means salivation is having lacrimation followed by that? Yes. Actually, when you have food, you need saliva, but along with saliva comes the tears. Why the tears come with saliva? Due to some misdirection of the regenerating nerve. You mean to say facial nerve has been damaged and regenerating? Yes, but there was a misdirection of fiber. Misdirection of fiber means they were going to some place and then they have gone to some other place? Yes. Misdirection of fiber. So, what is the answer then? Answer, we have to find out. Okay, then find out. Actually, this is an injury where the lacrimatory pathway is not yet given. Lacrimatory pathway is not yet given. Yes. Then what is the answer? It is before giving the lacrimatory pathway? Yes. Okay, then I think this is the answer. Yeah, okay, fine. This is the answer. But why this is the answer? Because you told me before lacrimatory pathway given. So let us look at the course of the nerve and find out why this is the answer. We have to find out. Let me discuss it shortly in this patient. What happened was, whenever she's having food, saliva was coming, but along with saliva, tears were also coming. This is called a crocodile tear syndrome. Why it is happening? What happened was, there was some viral exposure, Bell's palsy something. Viral exposure, Bell's palsy or something like that. And where was the nerve involved? You have to understand that there are two nuclei. What are the two nuclei? You see, there is one lacrimatory nucleus, which is a part of superior salivatory nucleus. So lacrimatory nucleus is a part of superior salivatory nucleus. Yes, for the control of salivary gland, lacrimal gland. So control of salivary gland, lacrimal gland. Yes. Okay. You are telling lacrimatory nucleus is a part of superior salivatory nucleus and they supply salivary gland, lacrimal gland. Yes. Okay. Then what happened? Actually, we have the, say, for example, this is lacrimatory pathway to the lacrimal gland. Yeah. Okay. Fine. And this is the salivary pathway to the salivary gland. Yeah, okay, fine. But they go together. They go together means there is a facial nerve carrying both of them. Yes. So there is a lacrimatory nucleus which is controlling lacrimatory secretion, and there is a salivatory nucleus controlling the salivary secretion, and but carried by same nerve, facial nerves. This facial nerve was damaged before lacrimatory pathway was given. You mean to say before lacrimatory pathway given means before geniculate ganglion? Yes, before geniculate ganglion. So facial nerve injured before geniculate ganglion due to exposure to some virus. Bell's palsy. Yeah, Bell's palsy maybe. So what happened? What happened was there was a crocodile tear syndrome. What is that? Facial nerve was regenerating. Yes. Let us assume 10 salivary fibers were regenerating. How many? 10. So you are telling that there were some 10 salivary fibers regenerating? Yes. But 10 salivary fibers. So 10 salivary fibers were regenerating now. Yes. So what about that? 10 salivary fibers were regenerating, but only 8 have reached the salivary gland. Then where are the other 2 going? They are going by mistake to the lacrimal gland. You mean to say fibers are coming from superior salivatory nucleus, salivary fibers? Yes. But they are now mistaken and supplying lacrimal gland? Yes, that is the point. There are 10 salivary fibers that's supposed to regenerate into salivary gland, but only 8 out of 10 have come to the salivary gland. 2 out of 10 have been misdirected into the lacrimal gland. So 10 salivary fibers are growing and 8 are growing into the salivary gland, which is normal, but 2 were mistaken and growing into the tear gland. Yes, that's why whenever she is having food, saliva will be given by 8 fibers, but the other 2 salivary fibers, they will give tears. So tears will come with saliva. This is called crocodile tear syndrome. See, if the salivary fibers go to the tear gland, they will not give saliva, they will give tears. So they are actually salivary fibers but giving tears. Yes, that is the point. This is called crocodile tear syndrome. Let us discuss some more details. Now, as you want to discuss more details of this lady, do you remember something? Where is the facial nerve coming from? At the pontomedullary junction. If you say facial nerve is coming at the pontomedullary junction, fine. As the facial nerve comes from, the nuclei are in the pons. Maybe the nerve is exiting at the pontomedullary junction, but the nuclei are in the pons. So there are some nuclei in the pons, yes. But the nerve exit at pontomedullary junction, yes. Okay, fine. Then you have to understand that it is going to supply some pterygopulsant ganglion to control LNP gland. It is going to supply submandibular ganglion to control the sublingual submandibular salivary gland. It is controlling lacrimal gland, sublingual gland, submandibular gland, also carry taste from the anterior two-third of tongue. Actually, facial nerve is supposed to supply lacrimal gland, sublingual gland, submandibular gland, and also carry taste from anterior two-third of tongue. Cauda tympani nerve is a branch of facial nerve, all that. And it also supplies muscles of facial expression. It also supplies muscles of facial expression. This is all facial nerve territory. Okay, lacrimal gland, sublingual gland, submandibular gland, taste also, nasal gland, palatine gland, all that? Yes, fine. What if there is a Bell's palsy? If there is a Bell's palsy, depends which level it was injured, and some clinical features may be coming, some may be missing. So depending on the level of lesion, yes. Okay, what about this patient now? See, the muscles which it is supplying are muscles of facial expression. Could be orbicularis oris. Shut the eyelid. Oculi. This is orbicularis oculi. Shut the eyelid. Orbicularis oris will shut the mouth. When you whistle, this is orbicularis oris. So orbicularis oris will help me to whistle. Yes. And then I'll shut my eyelid tightly with the orbicularis oculi. Yes. Then you have zygomaticus major for smiling. You have zygomaticus major for smiling. And you have buccinator. What is buccinator for? Sir, you are making a fake smile. Yeah, fake smile. I can smile also. But, sir, you are laughing now. Yeah, okay, fine. But zygomaticus major is basically for smiling, smile muscle. Why are you telling them like that? Because I have to discuss a patient now. What patient? See, this patient. Why, what happened here? Bell's palsy. What Bell's palsy? What happened? Actually, there is failure to close the eyelids. Why? Orbicularis oculi paralyzed on left side and cannot smile. Why cannot smile? Because zygomaticus major is not working. There is dribbling of saliva. Why dribbling of saliva? Because buccinator muscle is paralyzed. Buccinator normally keep pushing the saliva towards the gut tube. But if buccinator is not working, this is left side. If buccinator is not working, dribbling of saliva. So dribbling of saliva, yes. And cannot smile? No. And this cannot. So you mean to say I have to pad the eyeball? Yeah, you have to pad the eyeball. And you have to tell the patient, put the finger into mouth and take the food out, because collection of food here because buccinator is not working. All that problems. Facial palsy. Okay, facial palsy, fine. What else? Now we have to go into the details of the nerve. This is the lady you have discussed. Let us talk more details. Go deeper now. The branches. Yes, branches. Okay, let's go deeper. This is the diagram which we are supposed to draw. But before you draw the diagram, you just see the details. Then you draw. So what are the details? Do you know that anterior 2/3 of tongue taste is carried by cauda tympani nerve towards the facial nerve towards which nucleus? Taste of the anterior 2/3 of tongue. Taste of the anterior 2/3 of tongue is carried by cauda tympani nerve towards the facial nerve towards which nucleus? Towards the tip of the nucleus tractus solitarius. Towards the tip of the nucleus tractus solitarius. And what about the other nuclei of facial nerve? Other nuclei of facial nerve you have seen, but first you tell about the geniculate ganglion. Where is the geniculate ganglion? It is in the middle ear cavity and it has some taste sensory neuron. So this is the geniculate ganglion which is in the middle ear cavity having some taste sensory neuron. It is in the taste pathway. Yes, it is in the taste pathway. Then you have superior salivatory nucleus controlling 5 glands on the face. Remember those 5 glands using 2 ganglia? So you're telling this is some superior salivatory nucleus controlling 5 glands on the face, 2 ganglia. Which ganglia? Which glands? The glands are L for lacrimal, N for nasal, P for palatine, and then one is under the tongue, sublingual, under the mandible, submandible. 5 glands of the face control by facial nerve and 2 ganglia. What are the 2 ganglia? One of them is called as the pterygopalatine ganglion, the other is called as the submandible ganglion. And what are the nerves carrying the preganglionic fiber? Preganglionic, yes. See, pterygopalatine ganglion, which is controlling L for lacrimal, N for nasal gland, P for palatine gland, will have one nerve called greater petrosal nerve. And if you're talking about the sublingual, submandibular, then cauda tympani nerve. Can I see cauda tympani nerve, greater petrosal nerve then? Yeah, okay, let's see. This is the greater petrosal nerve, which is controlling the pterygopalatine ganglion to control the LNP gland, and this is the cauda tympani nerve, which is controlling sublingual, submandibular, salivary gland. They carry only the preganglionic fiber. They are branches of facial nerve. These are the functional nerve. So if they are functional nerve, then who is the topographic nerve? Topographic nerve are the trigeminal branches. If you say topographic nerve are the trigeminal branches, they will be carrying the postganglionic fibers now. Yes, you already know that. Topographic is trigeminal. So this is the trigeminal nerve. Tell me about the topographic nerve. Trigeminal is giving 3 branches and they will be topographically related like which one? This is we have discussed here. What is this? Mandibular nerve giving the lingual nerve. You are talking about the lingual nerve, branch of the mandibular nerve, branch of the trigeminal nerve, not the topographic nerve. Yes. Remember, lingual nerve, which is a branch of the mandibular nerve, branch of the trigeminal nerve, is joined by cauda tympani nerve. Cauda tympani nerve is joining lingual nerve in the infratemporal fossa is one MCQ. You are telling cauda tympani nerve will join the lingual nerve in the infratemporal fossa. Infratemporal fossa? Yes, below the temporal bone, infratemporal fossa. Why? For? See, lingual nerve is going to carry the postganglionic fiber towards the sublingual and submandible salivary gland. So lingual nerve is carrying postganglionic fiber towards sublingual, submandibular salivary gland. Who was carrying the preganglionic? The cauda tympani. So cauda tympani nerve carry only the preganglionic fiber to the submandible ganglion, and the postganglionic will be carried by the sublingual, submandibular salivary gland, the branches of lingual nerve, topographic nerve. Now once you have that idea, fine. What is this internal carotid artery doing? Internal carotid artery, you remember, was surrounded by some T1 sympathetic plexus. That T1 sympathetic plexus around Internal carotid artery is giving a sympathetic nerve, and that sympathetic nerve is called deep petrosal nerve. So there is a deep petrosal nerve which is coming from the T1 sympathetic plexus. Yes, actually. Around the internal carotid artery, you have some T1 sympathetic plexus coming from superior cervical ganglion. Superior cervical ganglion gave you some T1 sympathetic plexus, making a plexus around the internal carotid artery, giving a sympathetic nerve called deep petrosal nerve. Now it is joining greater petrosal nerve, which is a parasympathetic nerve. Greater petrosal nerve is a parasympathetic nerve. So what will happen when they join? When the greater petrosal nerve, which is a parasympathetic nerve, joining the deep petrosal nerve, which is a sympathetic nerve, they'll together form the Vidian nerve of pterygoid canal, and you can cut the Vidian nerve of pterygoid canal if you have a case of vasomotor rhinitis with intractable rhinorrhea. You are having a case of vasomotor rhinitis with intractable rhinorrhea, running nose. You cut this nerve, which the Vidianectomy. Yes, Vidianectomy can be done, though it is no longer performed operation, but it has historical importance. That's why questions still come. So Vidianectomy, yes. For a case of intractable rhinorrhea, yes. This nerve is supposed to go towards the pterygopalpine ganglion and then control the nasal gland. So it is going towards the pterygopalpine ganglion, then controlling the nasal gland. Yes. You could have cut that nerve to reduce the secretion of nose. Okay, fine. What about this facial nerve exiting cranial cavity? Facial nerve has to exit the cranial cavity, passing stylomastoid foramen, and then it will pass through the parotid gland and supply the muscles of facial expression, like you had orbicularis oculi, or the zygomatic, or the buccinator, or the orbicularis oris. But before it supply the muscles of facial expression, it already has passed through the parotid gland, and before that it has passed the stylomastoid foramen. Now, maybe facial nerve is passing through the parotid gland. It do not supply the parotid gland. Parotid gland is supplied by glossopharyngeal nerve. Facial nerve just passes through the parotid gland without supplying the parotid gland. Parotid is supplied by glossopharyngeal nerve. This information we needed. Now, this is the case you are talking about, and you have to draw a diagram for that. So this is the case we are talking about. We have to draw the diagram. But before you draw the diagram, you just have some idea of the middle ear cavity, and there you will have some branches given, like there will be greater petrosal nerve, there is the nerve to stapedius, and there is the cauda tympani nerve. You are now going into middle ear cavity. Where in the middle ear cavity? Here. This area will magnify? Yes, magnify this area. So when we are magnifying this area, what is there? See, this is the genu of the facial nerve, external genu. Where is the external genu of facial nerve? It is external band of facial nerve in the middle ear cavity. There you have the geniculate ganglion, and after that is given the greater petrosal nerve, which is going towards the pterygopalpine ganglion to control the LNP gland. It is topographically related with maxillary nerve, branch of the trigeminal nerve. See, this is the genu, external genu of the facial nerve in the middle ear cavity, and giving the greater petrosal nerve, which is topographically related with the maxillary nerve, branch of the trigeminal nerve. And what else? See, this is the facial nerve in the facial canal. Where? In the posterior wall of the middle ear cavity. If you say this is the facial nerve in the facial canal, in the posterior wall of the middle ear cavity, then it is giving three branches. What it has already given, that was the greater petrosal nerve. What is the second one? Nerve to stapedius. And what is the third one? Cauda tympani nerve on the tympanic membrane. If you say cauda tympani nerve is on the tympanic membrane, it is related to the malleus bone also on tympanic membrane, then where is it going? It is going to join a branch of the mandibular nerve trigeminal, named lingual nerve. Where? Infratemporal fossa. So you are telling this is the lingual nerve, which is a branch of the mandibular nerve, branch of the trigeminal nerve. Yes. And what is this joining? Where it is? Infratemporal fossa. Remember, cauda tympani nerve carry the preganglionic fiber towards the submandible ganglion. Later, it is the lingual nerve which will carry the postganglionic fiber. How the facial nerve is exiting the cranial cavity. Facial nerve is exiting cranial cavity, passing stylomastoid foramen. After that, it will supply the muscles of facial expression. So this is the diagram which we want to follow. Yes, this is the middle ear cavity. You can see there. The roof is tegmen tympani. You are telling that the roof of the middle ear cavity is tegmen tympani. Yes. Then what is the posterior wall? Posterior wall, you have the facial nerve running. And what is the lateral wall? Lateral wall will be tympanic membrane, where you have this cauda tympani nerve. Cauda tympani nerve is the lateral wall of the middle ear cavity on tympanic membrane. Yes. What is the anterior wall? Anterior wall is this eustachian tube, bony part. Bony part of eustachian tube is anterior wall of middle ear cavity. Yes. Roof is the tegmen tympani separating from the brain here. Yes. Yes. Okay, we'll discuss middle ear cavity later also, but here, facial nerve. We're looking at this lady now. You have put her in a CT scan machine, and this is the view. You mean to say inferior to superior? Yes. And this is the right side. Yes. This is anterior side, the nose, and this is the right side ear. So this will be anterior side, the nose. Yes. And this is right side, the ear, right ear. Yes. That view. Yes. What are you taking? A CT scan, transverse section of the pons. Why pons? Because facial nerve nuclei in the pons. Oh, facial nerve nuclei in the pons? Yes. Okay. This is the diagram. Yes. Lower pons. Yes, lower pons. You remember in the lower pons, there was some facial colliculus at the floor of the fourth ventricle, sandwich between cerebellum and brainstem. See, this is the fourth ventricle, which is sandwiched between the pons anteriorly as the floor. And what is the roof? That will be cerebellum posteriorly. So cerebellum will be posterior as the roof. Yes. And pons is anterior as the floor. What is at the floor of the fourth ventricle then? Actually, it is rounded elevation called facial colliculus. So you have some rounded elevation facial colliculus at the floor of the fourth ventricle now. Why do we have facial colliculus? Because of some axons of the facial nerve going around the abducens nucleus. You are telling that deep to the facial colliculus is the abducens nucleus? Yes, but be careful, abducens nucleus do not produce the elevation. Don't mention abducens nucleus, which is deep to facial colliculus, is producing the elevation. No. This elevation is not because of the nucleus. Then why it is? Because of these axons of facial nerve. This is called internal genu of the facial nerve. So this is some axons of the facial nerve. Yes. Internal genu of the facial nerve. Yes. Where the facial nerve fibers are coming from. These are the fibers which are producing the elevation called facial colliculus, not the abducens nucleus. So this is the facial nucleus now? Yes, controlling the muscles of facial expression. So facial nucleus, which is supposed to control the muscle of facial expression, yes, is sending some fibers which are taking a bend of fiber in the lower pons. And that bend of fiber in the lower pons is called, internal genu of the facial nerve. Internal genu of the facial nerve. And that internal genu of the facial nerve is seen before the nerve is exiting at pontomedullary junction. This nerve has to exit at pontomedullary junction, but before that it would have taken a bend, and that bend is producing the rounded elevation, which are called as the facial colliculus. If there is a facial colliculus damage, the muscle paralyzed or risorius, first answer, and lateral rectus, second answer. Why risorius is the first answer? Because risorius is facial nerve axons and lateral rectus is the abducens nerve axon. First answer should always be the risorius supplied by facial nerve. Second answer could be lateral rectus supplied by abducens. Facial colliculus syndrome. Paralysis of two muscles. Okay. This is the diagram you want to talk about now. Yes. Actually, I want you to draw the diagram. Which diagram? Brainstem and pons and pontomedullary junction and facial nerve and exiting now to supply muscles of facial expression and giving some branches like hiatus petrosal and nerve to stapedius and cauda tympani. So this is the diagram we are supposed to draw? Yes. Okay, then draw the diagram. This is the diagram we are drawing, and as you draw, you have to start with brainstem. Let us start with the brainstem. So starting with brainstem, which part of brainstem you are focusing upon? I have to focus upon the pons. This is the brainstem and we have to focus upon the pons. Now, which nucleus in the pons? Actually, in the pons, we have superior salivatory nucleus and inferior salivatory nucleus, if you remember. And superior salivatory nucleus is for the facial nerve to control 5 glands on the face. If you say in the lower pons, you have superior salivatory nucleus and inferior salivatory nucleus. The superior salivatory nucleus is for the facial nerve to control the 5 glands on the face. What are the 5 glands? That will draw a diagram and see, but this is GVE. What is GVE? G for general, V for visceral, E for muscle. General visceral muscle, the smooth muscle of the 5 glands of the face. You mean to say secretomotor fibers? Yes, secretomotor fibers. You are talking about lower pons here? Brainstem? Yes. Having superior salivatory nucleus and inferior salivatory nucleus? Yes. And superior salivatory nucleus is for the facial nerve controlling 5 glands on the face? Yes. Which is under the neural column at GVE. G for general, V for visceral, E for muscle. Yes, general visceral muscle, smooth muscle of these 5 glands. This is secretomotor fibers. Okay, what about the inferior salivatory nucleus? Inferior salivatory nucleus is this. It is for the 9th nerve to control parotid salivary gland. In the lower pons, you have the nucleus. So you're telling inferior salivatory nucleus is for the glossopharyngeal nerve to control the parotid gland. Yes, secretomotor fibers, parotid gland. Now, you have to look at one motor nucleus of the facial nerve. And where is that? The motor nucleus of facial nerve is here. So this is the motor nucleus of facial nerve for controlling the muscles of facial expression. Facial expression. Okay, fine. What the axons are doing? Axons. Let me show you what the axons are doing. The nucleus is here. Axons take a bend of fiber before they exit at the pontomedullary junction. Oh, you are telling there is a motor nucleus of facial nerve which is taking a bend of fiber before they exit at the pontomedullary junction, and that bend of the fiber was producing some rounded elevation facial colliculus. Yes. Internal geniofacial nerve, yes, facial colliculus. Lower pons, yes, lower pons. Understand? We are talking about facial colliculus, which is in the lower pons, on the dorsal side of lower pons, yes. Why? Because of some internal genu of facial nerve. So there is a bend of fiber, internal geniofacial nerve, yes, producing a rounded elevation on the posterior side, yes. At the floor of the 4th ventricle, yes, floor of the 4th ventricle. These are all questions. And what is this fibers for? The motor nucleus, yes, it is for the muscles of facial expression. If you say it is for the muscles of facial expression, I think the muscles of facial expression, yes, are SVE. Why? Because they are developing in second pharyngeal arch. Second pharyngeal arch SVE. What is S for? S for the special, V for visceral, E for muscle. Special visceral muscle, the pharyngeal arch muscle? Yes. So special visceral muscle, the pharyngeal arch muscle, muscles of second pharyngeal arch, controlled by facial nerve. So this facial nerve has SVE. I thought it has GVE. Yeah, it has SVE, it has GVE, it has SVE also. How it has SVA also? You remember sweat and tears taste pathway? Sweat and tears taste pathway. Let us discuss the sweat and tears taste pathway also now. But it has SVE, it has GVE also. So it has a lot of nuclei. Yes. Now remember, maybe this nucleus or maybe that nucleus, the fibers are passing the same pathway. So fibers will come from here and join here. Yes. You're telling maybe this was the nucleus or maybe that was the nucleus. They are all joined and exiting at pontomedullary junction. Yeah, whatever nuclei you had for the facial nerve, maybe this nucleus which is motor, this is secretomotor nucleus, whichever. All the axons will join and exit at pontomedullary junction. Okay, what they will do? The facial nerve, yes. The facial nerve is now going to enter internal auditory meatus to enter middle ear cavity and take a band of fiber there called as external genu of the facial nerve. Where? In the middle ear cavity. You're telling that facial nerve exit at pontomedullary junction? Yes. And what is it doing now? Entering the middle ear cavity, passing internal auditory meatus. So it is passing internal auditory meatus now. Yes. To enter the middle ear cavity. Yes. And what is it doing in the middle ear cavity? Taking a band of fiber which is called external genu. There you have a geniculate ganglion also. If you say there you have the geniculate ganglion, I think the geniculate ganglion is in the middle ear cavity. Yes, it is there in the middle ear cavity, having some taste sensory neuron. Taste sensory neuron. And then you are telling there's internal genu also. Yeah, but internal genu of facial nerve was here. Remember, internal genu of facial nerve is in the lower pons on the dorsal side, lower pons, whereas the external genu of facial nerve is in the middle ear cavity, having a geniculate ganglion also. And what is the facial nerve doing now after taking a bend of fibers in the middle ear cavity? It was actually running in the middle ear cavity, in the posterior wall of the middle ear cavity. Yes, giving 3 branches. And what are the 3 branches it is giving? We have to name the 3 branches it is giving. But before you discuss the 3 branches of facial nerve given by facial canal, means facial nerve is running in the middle ear cavity, in the posterior wall of the middle ear cavity, giving 3 branches. We have to name them, but before that you have to tell me how the facial nerve exit the cranial cavity. To exit the cranial cavity, it was having a foramen here, and that foramen was called as, to exit the cranial cavity, it was passing through some foramen, and that foramen was called stylomastoid foramen. And after passing stylomastoid foramen, it is passing through this gland. What gland? Parotid salivary gland. And after passing parotid salivary gland, what is it doing? Supplying the muscles of the facial expression. Muscles of the facial expression. Okay, you are telling facial nerve will exit the cranial cavity passing stylomastoid foramen? Yes. Then pass through the parotid gland and do not supply the parotid gland? No, it is not supplying the parotid gland. It is just passing through the parotid gland. And then it is going to supply muscle of facial expression. Yes. Like orbicularis oculi and the buccinator and the orbicularis oris. Yes. If you say facial nerve do not supply the parotid gland, then who is supplying? That was this nucleus. Which nucleus? Inferior salivatory nucleus. You are telling that there is some inferior salivatory nucleus shunting the preganglionic fiber by the glossopharyngeal nerve and going to control the parotid salivary gland. They are not the facial nerve. No, not the facial nerve. Glossopharyngeal nerve. Inferior salivatory nucleus. Okay, fine. That is not the discussion. This is facial nerve. Continue with facial nerve. As you continue with facial nerve, you shall see. What is the name of the first branch? It is greater petrosal nerve synapsing in a ganglion which is called pterygopalatine ganglion. What is the name of the nerve? GPN. What is GPN? Greater petrosal nerve. Are you trying to say greater petrosal nerve is the first branch of the facial nerve in the facial canal? Yes. Greater petrosal nerve is the first branch of the facial nerve in the facial canal and synapsing with pterygopalatine ganglion to control the LNP gland. LNP gland. What is this LNP gland? I don't know. If you don't know, then you draw the diagram of the face. Then you will know. This is the eyes, this is the nose, that is the mouth, and this is L for lacrimal gland, N for nasal gland, and P for palatine gland. You are talking about LNP gland. Yes. L for lacrimal, N for nasal, P for palatine gland, controlled by a single ganglion. That ganglion is pterygopalatine ganglion. What will happen if I damage the pterygopalatine ganglion? Then the eye will become dry, the nose will become dry, the palate will become dry, the LNP glands will become dry, total dryness. It controls the secretions. Now, once you say so, fine. What about the other glands? Which one? The one which is under the tongue, under the mandible. If you say under the mandible, under the tongue, This is submandible and sublingual salivary gland. Tell me who is controlling submandible, sublingual salivary gland, because there are 5 glands on the face controlled by the facial nerve using superior salivatory nucleus. Superior salivatory nucleus control 5 glands on the face, and they are here. Now tell me who is controlling submandible and sublingual salivary gland. That is actually third branch of the facial nerve, name cauda tympani nerve. So you're telling CTN is cauda tympani nerve now? Yes, third branch of facial nerve in the facial canal. If you say CTN is the cauda tympani nerve, which is the third branch of the facial nerve in the facial canal, where is it going? It is going under the mandible. Why it is going under the mandible? It is going under the mandible because you have a ganglion called submandible ganglion under the mandible to control the submandible and sublingual salivary gland. Controlling submandible, sublingual salivary gland. Yes. Okay. Fine. But I think this cauda tympani nerve is supposed to carry some taste pathway. Yes. Yes. Carry the taste pathway now. Remember, taste pathway from anterior 2/3 of the tongue is carried by cauda tympani nerve. What is that? Taste of the anterior 2/3 of the tongue. You are telling that this time taste of the anterior 2/3 of tongue? Yes. Taste of the anterior 2/3 of tongue is carried by the cauda tympani nerve branch of the facial nerve to where? To the facial nerve. And from the facial nerve where? To the geniculate ganglion. And from the geniculate ganglion where? Let us see where. But this is the one which is having the taste sensitive fibers. So you are trying to say taste from the anterior 2/3 of tongue is carried by cauda tympani nerve towards the facial nerve is carrying it to the geniculate ganglion. Now the geniculate ganglion will send the central processes where? Because these are the peripheral process to receive the taste. Now the central process of the geniculate ganglion, where they will go? They are following the facial nerve to the tip of the nucleus tractus solitarius. What is that? Tip of the nucleus tractus solitarius. That's where the taste will come. Oh, you are telling. Geniculate ganglion will send the central processes into the tip of the nucleus tractus solitarius in the lateral medulla. Yes, lateral medulla. You remember lateral medulla. Now, if you say this is tip of the nucleus tractus solitarius in the lateral medulla, I think we have a mnemonic here. Yes, you have a mnemonic. Your mnemonic is SWAT and TS. What is this mnemonic SWAT and TS? What is T for? T for taste. Special visceral sensation. S for special, V for visceral, A for sensation. Special visceral sensation of the taste going to the tip of the nucleus tractus solitarius. Tip of the nucleus tractus solitarius is also receiving taste from the palate. Do you remember which nerve carries taste of the palate, which will come here only? Do you remember? I have discussed that earlier. Follow the taste of the palate now. Taste of the palate. Yes, this is the taste of the palate. So now you are telling this is the taste of the palate. Yes, taste of the palate. Now you are talking about the taste of the palate. Yes. Who is carrying that? Do you remember the name of the nerve? Greater petrosal nerve. Greater petrosal nerve. So taste of the palate is carried by greater petrosal nerve towards facial nerve and towards geniculate ganglion and towards nucleus tractus solitarius. So you are telling it the same story. Yes. After that, it is same story. So taste of the palate is carried by the greater petrosal nerve towards facial nerve, towards geniculate ganglion, towards facial nerve, towards tip of the nucleus tractus solitarius. So what if I have a patient who is having injury to greater petrosal nerve? If you have a patient who has injury to greater petrosal nerve, then LNP gland will become dry, the eye will become dry, nose will become dry, palate will become dry, LNP gland become dry, because you are telling it's a case of greater petrosal nerve injury. Along with the dryness in the LNP gland, there is also loss of taste sensation from the palate. Loss of taste sensation from palate. And what about the second patient who is having injury to the chorda tympani nerve? If you have a second patient who has injury to chorda tympani nerve, then you will see there is decreased saliva. Decreased saliva from where? The parotid gland? No, not the parotid gland. There will be decreased saliva from the sublingual and submandibular salivary gland. So, injury of chorda tympani nerve, there is decreased saliva from the submandibular and sublingual salivary gland, and also loss of taste from the anterior 2/3 of the tongue. And what if I have injury to this nerve? Who is this? This is the nerve to stapedius, the second branch of the facial nerve in the facial canal. Injury. You're telling nerve to stapedius is the second branch of the facial nerve in the facial canal? Yes. There are 3 branches. So this is nerve to stapedius. It is gone. Yes. What will happen? Hyperacusis. What is hyperacusis? Painful hearing. But why this painful hearing? Because stapedius is a reflex. What reflex? Actually, stapedius is dampening the sound. Dampening the sound. And what if stapedius is not dampening the sound? Then any normal sound appear painful. Hyperacusis, more hearing, painful hearing. So injury to the nerve to stapedius will paralyze stapedius? Yes. No more dampening of sound? No. So painful hearing, hyperacusis? Yes. Okay. What about that artery you were talking about? There was some artery. Internal carotid artery. When we were talking about the internal carotid artery, actually it was surrounded by some T1 sympathetic plexus, and that the sympathetic plexus T1 was giving some sympathetic nerve called as deep petrosal nerve. You remember? You are talking about some internal carotid artery here? Yes. Surrounded by T1 sympathetic plexus, which came from the superior cervical ganglion. Yes, the Horner pathway. And it is giving some sympathetic nerve, which is called deep petrosal nerve. Yes, sympathetic nerve, deep petrosal nerve. And it is joining some parasympathetic nerve, which is greater petrosal nerve. Yes, it is joining the parasympathetic nerve, which is greater petrosal nerve. And running along with that? Yes, running along with that. And that is called as the Vidian nerve of pterygoid canal, going towards the pterygopalatine ganglion. So you're telling that there's internal carotid artery surrounded by T1 sympathetic plexus giving you T1 sympathetic plexus giving sympathetic nerve, deep petrosal nerve, joined by parasympathetic nerve, greater petrosal nerve, together running as Vidian nerve of pterygoid canal, which is going towards the pterygopalatine ganglion. This is the one which I was cutting Vidianectomy. Yes, you were doing Vidianectomy if you had a case of vasomotor rhinitis, intractable rhinorrhea. Then you have cut the Vidian nerve, Vidianectomy. You know where this Vidian nerve of pterygoid canal is formed? It is at the floor of foramen lacerum. Now you have to look at the floor of the foramen lacerum. Formation of Vidian nerve of pterygoid canal. This is our discussion, the next discussion. But before you go there, can you tell me one thing? Greater petrosal nerve is carrying preganglionic fiber. It is a functional nerve, facial nerve. The chorda tympani nerve is carrying the preganglionic fiber, facial nerve, functional nerve. Who is carrying the postganglionic fiber here? Who is carrying the postganglionic fiber there? Must be the branches of trigeminal. And actually you have discussed the branches of trigeminal here. You remember the name of this nerve? If you remember, we have discussed this is lingual nerve and is a branch of, this is lingual nerve, which is a branch of mandibular nerve, and mandibular nerve is a branch of the trigeminal nerve and is supplying. Actually, this is lingual nerve, which is a branch of the mandibular nerve, branch of the trigeminal nerve to carry the postganglionic fiber towards the sublingual, submandibular salivary gland. Then who was carrying the preganglionic fiber? That was the chorda tympani nerve. Chorda tympani nerve carry the preganglionic fiber, functional nerve. This is topographic nerve, the lingual nerve, carrying postganglionic fibers. These are all MCQs. In this particular diagram, there are some 40 MCQs, 40 MCQs. We have taken care of around 40 MCQs here. You believe or not? My diagrams are like that only. Each diagram caters to a lot of MCQs. You will realize only when you practice the MCQs. Okay, what is the answer to this MCQ then? It is asking facial colliculus. If it is asking facial colliculus exception, yes. I think facial colliculus is raised by some axons of the facial nerve making some internal genuine in the lower pons. Correct. Abducens nucleus lying deep to that, yes, but not producing the elevation. Located at the floor of the fourth ventricle, yes. You mean to say this is the answer? Choice number. You mean to say this is the answer? Choice number D, yes. Why? Because present on the dorsal aspect of, not the upper. It was lower pons. It was caudal pons. So lower pons, caudal pons. Yes, lower or caudal pons. If you say so, the answer is choice number D. Yes, you have already seen this. This is facial nucleus and this is caudal pons. It is sending some fiber which is internal genu, producing a rounder elevation at the floor of fourth ventricle. But it is caudal pon, not the upper, it is lower pons. Okay, fine. So you mean to say this is the answer? Yes, that is the answer because it is not upper, it is lower or caudal pon. Keep that answer. Then I got one more question on foramen lacerum. What about that? Actually, at the floor of foramen lacerum, you will find 5 structures. What are the 5 structures at the floor of foramen lacerum? Let us discuss. And you have to look at the patient deeper into the patient. You want to look at the deeper area? Yes. What deeper area? The level of foramen lacerum. Level of foramen lacerum? Yes. Okay. Tell me then. This area here actually, foramen lacerum. You mean to say the area where you have the formation of the Vidian nerve of the pterygoid canal? Yes, that area. Let's go there. You will now find that there is the foramen lacerum and it is closed by a plate of fibrocartilage. What is it? It is closed by a plate of fibrocartilage so that not any important structure passing, only some emissary veins and some arteries may be passing. So because it is closed by some plate of fibrocartilage, some emissary vein and some 3 branches are passing, not some important thing? No. Then what is this internal carotid artery doing? Actually, internal carotid artery will enter carotid canal and will be passing at the floor of the foramen lacerum. Floor of the foramen lacerum. So you are telling that internal carotid artery will enter carotid canal. Yes. At the base of the skull. Yes. So internal carotid artery will enter the carotid canal at the base of the skull and pass at the floor of the foramen lacerum. And what is it surrounded by? Surrounded by some T1 sympathetic plexus, and the T1 sympathetic plexus is giving me the deep petrosal nerve, and the deep petrosal nerve is the joined by the greater petrosal nerve, and together they will be forming the Vidian nerve of pterygoid canal. Now remember, Vidian nerve of pterygoid canal is formed at the floor of the foramen lacerum. Vidian nerve of pterygoid canal is formed at the floor of foramen lacerum, and then where is it going? Of course, to the pterygopalatal ganglion, which is also called sphenopalatine ganglion. It is going towards the pterygopalatal ganglion, which is also called sphenopalatine ganglion. Now tell me, what are the 5 structures at the floor of the foramen lacerum? Tell me the 5 structures at the floor of the foramen lacerum, because they are all involved in the formation of Vidian nerve. One of them is Vidian nerve itself. So what are the 4 others? Of course, they are internal carotid artery and T1 sympathetic plexus and making the deep petrosal nerve and is joined by the greater petrosal nerve and together forming Vidian nerve. So they're all at the floor of the foramen lacerum, but they're not passing through the foramen lacerum. If you say they are not passing through the foramen lacerum. Why? Because I told you that foramen lacerum, if you say, it is closed by a plate of fibrocartilage, and these structures are not passing through the foramen lacerum, they are just at the floor of the foramen lacerum. That's the thing here. 5 structures. Yes. This is one of the questions whose answer you should immediately tell me. Tell me. Is the facial nerve GVE? Yes. How? G for general, V for visceral, E for muscle. G for general, V for visceral, E for muscle. General visceral muscle, who is that? The smooth muscle of the 5 glands on the face. L, N, P. Sublingual, submandibular salivary gland. Secretomotor fibers. Nucleus. Nucleus is superior salivatory nucleus, controlling 5 glands on the face. Superior salivatory nucleus, parasympathetic nucleus. So it does have GVE, yes. It has SVE, yes. S for special, V for visceral, E for muscle. Special visceral muscle, muscle of the facial expression, developing in the second pharyngeal arch. Special visceral muscle, muscle of facial expression, developing in the second pharyngeal arch. It is also suatentious. What is suatentious? Taste carried to the tip of the nucleus tractus solitarius. What is S for? Special. What is V for? Visceral. What is A for? Sensation. Do you remember? Smell and taste is SV. Smell and taste is SV. Then who is SSA? SSA. It is the number 2 and 8. What is 2 for? Vision. 8 for hearing balance. So 2 is for vision and 8 is for hearing balance. Is SSA. What is SSA? SSA, special sensation of somatic nature. Special sensation of somatic nature. SSA is here. And what is smell and taste? SVA. So SV is there for the facial nerve, of course, taste. So it is not SSA. No. Why not SSA? You just told. The number 2 and the number 8 are SSA, not facial nerve. This is the number 2 and the number 8 for vision and hearing balance. So that is the answer. Of course, that is the answer.